Hello everyone and welcome to Rare à l'écoute, the podcast channel dedicated to rare diseases. Today we keep on exploring Gacki syndrome, or generalized arterial calcification of infancy syndrome. And to talk about it, we are pleased to welcome Professor Damien Bonnet. Professor Bonnet, good morning.
Bonjour.
Good morning.
Professor Bonnet, you are a cardiologist, a university professor at the Paris Descartes Faculty of Medicine, and head of the Pediatric and Congenital Cardiology Department at the Necker-Enfants Malades Hospital in Paris. Within the department, you coordinate the Reference Center for Cardiomyopathies and Rare Cardiac Rhythm Disorders, and the Reference Center for Complex Congenital Heart Malformations.
Alors, Professeur Bonnet, aujourd'hui, on aborde le syndrome Gacki.
Professor Bonnet, what are the main cardiac manifestations observed in young patients with Gacki syndrome?
Donc, l'artériopathie calcifiante infantile diffuse est une maladie génétique qui affecte
Diffuse infantile calcifying arteriopathy is a genetic disease that affects the entire circulatory system, and especially large and medium caliber arteries. The overall impairment of the cardiovascular system is related to the accumulation of calcium in these arteries, which gradually become stiff.
Cela va donner de l'hypertension artérielle, des atteintes des artères coronaires.
This will lead to arterial hypertension and damaged coronary arteries, heart perfusion, renal arteries, and less frequently other structures. The cardiac manifestations will be heart failure, strokes, hypertension, and renal failure of vascular origin.
And are these cardiac symptoms a common diagnosis entry point for this very rare disease?
So yes, indeed, it is an exceptionally rare disease that affects about 1 in 400,000 people. It is necessary to be aware of it to make the diagnosis. The cardiac symptoms are really predominant, particularly in fetuses, since the diagnosis can be made before birth on ultrasound signs, but most often in very young infants or even newborns. The manifestations will be breathing difficulties, edema, sometimes episodes of cyanosis, sometimes an aspect of a large heart on the X-ray, on which calcification of the arteries can also be detected, which are normally totally transparent on normal X-rays.
And regarding these cardiac symptoms that might suggest Gacki syndrome, what are the main differential diagnoses to rule out?
Les diagnostics différentiels sont relativement peu nombreux à partir du moment où on a exclu.
So the differential diagnoses are relatively few once you've excluded cardiac malformations that can lead to the non-specific symptoms that I have described, particularly hypertension and heart failure.
Une fois que le diagnostic d'une morphologie normale du cœur a été confirmé, on peut évoquer éventuellement d'autres causes d'insuffisance.
Once diagnosis of normal heart morphology has been confirmed, other causes of heart failure in very young infants, such as hereditary heart muscle disease, may be considered. But arterial calcification very quickly point to the diagnosis of Gacki syndrome.
Dans certaines formes de cette maladie un peu plus rares,
however, in certain slightly rarer forms of this disease, there are late manifestations and areas of overlap with other diffuse artery impairments, such as the ones seen in a disease called elastic pseudoxanthoma, or those that affect a protein known as elastin, a major constituent of the arterial wall. These may be elements of differential diagnosis.
And in terms of management, Professor Bonnet, what are the main principles of management of the cardiac manifestations of Gacki syndrome?
The management of cardiac manifestations is essentially symptomatic. We will give specific treatment for the arterial hypertension, since these rigid arteries will lead to arterial hypertension, as it can be observed in the course of aging. We will give treatments against fluid retention, salt and water, as in chronic heart failure. These are diuretic drugs, medication to help the heart in its function or in its perfusion. But of course, the main treatment is one of the arterial calcification.
vous en auront parlé, mais c'est vraiment le traitement de la cause.
This is really the treatment of the cause of the disease.
Et l'objectif étant d'assouplir les artères et donc
The
de
aim
rendre
is to
réversible
soften the
ces
arteries
manifestations
and therefore to
cardiaques,
make these
qui
cardiac
est l'objectif.
manifestations
Et
reversible.
aujourd'hui, on sait en particulier qu'on peut débuter ce type de traitement.
Today, we know that this type of treatment can be started even in the fetus, in certain reference centers.
Et pour conclure, professeur Bonnet, quel suivi
To conclude, Professor Bonnet, what follow-up should be recommended for these patients?
Alors le suivi est malheureusement, comme vous avez pu l'entendre,
The
certainement
follow-up
dans
is,
d'autres
unfortunately, as you may have
interviews,
heard in other
assez
interviews,
court
quite
puisque la
short,
mortalité des
since the
formes
mortality
révélées
of the
chez les très
forms
jeunes enfants,
disclosed in
les
very young
adolescents,
children,
cette
newborn and
mortalité est très
infants, is
élevée
very
dans les
high
6
in the
premiers
first
mois.
6 months of
Et
life.
donc il faut un suivi rapproché sur le plan cardiaque pour
It is
être à même de
necessary to have a
traiter à
close
temps de
follow-up of
façon
the cardiac
symptomatique,
function to be able to
comme je l'ai
treat early
déjà
enough,
dit précédemment,
symptomatically, as
et
I said
pour
before,
vérifier
and to
également
check the
l'efficacité du
effectiveness
traitement.
of
Donc
the
le suivi,
treatments.
c'est un suivi par des échographies,
The
en plus, bien
follow-up
sûr, de
is
l'examen clinique.
echocardiographic on top of the clinical examination.
Et on peut aussi recommander un suivi par un scanner qui
We
permet
can also
de
recommend a
vérifier
CT scan follow-up, which allows
la
us to check the
calcification de la
calcification
paroi
of the
artérielle et
arterial
éventuellement
wall and
sa
possibly its
régression
regression
avec les traitements
with
qui
the
sont aujourd'hui
treatments that are
proposés.
proposed today.
Eh bien, merci mille fois, professeur Bonnet, de nous avoir éclairé sur cette maladie très rare qui est le syndrome GACI. Quant à nous, chers auditeurs, si vous désirez aller...
Well, thank you very much, Professor Bonnet, for all this clear information on this very rare disease, the GACI syndrome. As for us, dear listeners, we thank you for your time and we look forward to seeing you on our podcast channel for a future episode on GACI syndrome. See you soon.